Hi everybody, I'm Dr. Sarah and welcome to your Blackheads Masterclass. So let's talk about exactly what blackheads are, why you get them, and what are the risk factors that are going to make you more likely to get blackheads.
Blackheads are a form of mild acne, although you probably wouldn't think that they would be super mild, judging by some of the blackheads that you can see in this video. They look pretty severe to me. But in general, blackheads are tiny bumps that represent clogged pores, and they look black or dark in colour. Now, what happens when that pore becomes clogged is essentially each pore has an oil gland, a hair follicle, and an opening to the skin. What can happen in acne is you get an excess of oil production, a colonization of bacteria on the skin, a buildup of oil and dead skin cells, and what can happen is that can block the pores. Now, when they become blocked with all this oil and debris and dead skin cells, they accumulate and become visible on the surface as a blackhead. And the reason they look black or dark in color is because all of that crud in the pore becomes oxidized when it's exposed to air. Now, you can get blackheads on any part of the body that you would normally get acne. So they most commonly occur on the face, but you can also get them on the neck, the chest, the back, and the shoulders. So some reasons why you might be particularly prone to blackheads are if you have particularly oily skin, if your skin has an overgrowth of acne-causing bacteria or P. acnes, or at particular times of your life when your hormones might be off balance. So during puberty in your teen years, when you have your period, or if you're taking a contraceptive pill. So those hormones can sometimes change the balance of oil and how things are sort of working in the skin. So you can become more prone to blackheads.
So now we know a little bit about blackheads. What are the best treatments for them and what can you do about them at home?
The best treatments for blackheads fall into two categories. So there are things that you can buy over the counter and they form part of your skincare routine. And the best ingredients you can use for blackheads is salicylic acid, which is a beta hydroxy acid, and it gets down into the pores, it dissolves all those dead skin cells and that buildup of oil, and it gets rid of them. Now, benzoyl peroxide is also a really great ingredient for blackheads and acne in general. It's anti-inflammatory and it's also antibacterial, so it kills the acne-causing bacteria that lives on the skin. Finally, topical retinoids are an excellent addition to your skincare routine if you're struggling with acne and blackheads. They regulate cell turnover and help to prevent the buildup of dead skin cells on the skin's surface. Now, the best treatments that you can have for blackheads are extraction. You can also have something like microdermabrasion or hydrofacial, which really gets into the pores and gives them a good clean, or salicylic acid and anti-inflammatory focused chemical peels.
Let's cover a really basic skincare routine that you guys can do at home that will really help to specifically target blackheads.
Any great skincare routine that's going to be particularly focused to blackheads is also going to be really beneficial for acne. And you often have other types of acne spots if you're struggling with blackheads. So the main takeaway from this is to wash your skin regularly, and twice a day should be enough, either with a salicylic acid or a benzoyl peroxide focused wash. Now, the other thing you want to incorporate into your routine is exfoliation, and you can use salicylic acid or alpha hydroxy acids like glycolic and lactic acids for that. The other ingredient that you should be incorporating into your routine on a nightly basis is a retinoid. So a typical routine would look like in the morning, you get up, you wash your face with your acne wash, you then let your skin dry, you moisturize, and you put on sunscreen. In the evening, you come home, you wash your skin again with your acne focused wash, you moisturize, you use your retinoid, and then you also use your moisturizer again. Now, exfoliation, you're going to be, if you're using a salicylic acid wash, you don't necessarily need to add in another exfoliant. But if you're using a benzoyl peroxide wash, then I would try and incorporate salicylic acid in either your morning or your evening routine. And it's really important not to forget to wear sunscreen, because that's going to be really beneficial for preventing any post-inflammatory hyperpigmentation.
So I hope you guys found that helpful. If you did, follow along, stay tuned for some more videos because I'm going to do quick masterclasses on other really common skin issues that you guys might be struggling with. So follow along, share, like the video, and I'll see you guys next time.